In this episode of Built for Growth, I have a very special guest. It is Dr. Jason Saunders. I'm really excited to dive into all of the things today with you and with him. He is a leading expert in hyperbaric oxygen therapy with over 17 years of experience, and he's currently completing his PhD in molecular biology. He's a very smart man, but I promise I'm not going to let him get too technical on us. We're going to talk about what is hyperbaric oxygen therapy and who does it best benefit. I am a huge advocate. If you've listened to me talk at all, you've probably heard me talk about hyperbaric oxygen therapy, HBOT, and how it has benefited me. But I'm curious about his testimonials and the people that he's worked with and the differences he has personally seen it make in his patient's life, and also his personal story, which is fascinating, how he came across HBOT. I, like myself, due to circumstance that was a sort of a misfortune or an injury. And it's going to be very interesting. We also talk about some of the science that best supports hyperbaric oxygen therapy. There's a lot of it, and you may be surprised how effective and how well studied it is. And you may even ask, why isn't this more prominent? Why isn't it used more often? So we'll get into that. And as always, thanks for listening. Jason, thanks for joining me today. We are in beautiful Pensacola, Florida at the International Hyperbarics Association conference, and you're talking a little bit later, yeah?
Talking a few times this weekend,
yeah,
exactly.
I plan to be there at least later today.
Perfect.
Yeah, what are you going to be talking about? What kind of cool stuff?
Well, a few things. One, I'd say the theme, if there is one, is really a lot about safety right now. Just, the industry's growing and there's a lot going on, so really keying into making sure that, from a let's say a clinical standpoint, everybody's operating as safely as possible. And then I always throw in a bunch on, protocols and, mechanisms of action, how to apply hyperbarics to be as effective as we can make it.
Yeah. Well, let's jump off there then. What is hyperbaric oxygen therapy? Tell the people who don't know.
Sure. So pretty simple, even right now, when we're sitting here having this conversation, the reason that when we breathe, we can bring oxygen into our body is because we have an atmosphere. That atmosphere has a pressure, and the pressure of our atmosphere is actually what allows oxygen to be driven from the environment into our bodies. I think a lot of people have an experience where if they've gone up in elevation or, they're from sea level, they go to Colorado or they go into the mountains, it feels harder to breathe. We say that there's less oxygen, but it's not a percentage difference. So air is 21% oxygen everywhere on planet Earth, essentially. But what happens as you leave the surface and you go up in elevation, you lose pressure. And as you lose pressure, you lose that driving force for pulling oxygen from the environment and getting it into your body. And hyperbarics is really the opposite of that. So hyperbarics is like mimicking below sea level pressures. So it's increasing pressure, it's increasing that driving force. And so what that allows us to do is really super saturate the body with far more oxygen than what would normally be possible in breathing air at regular atmospheric pressure.
And how did you find out about hyperbaric oxygen therapy? I kind of know because I know your story a little bit, but
I mean, essentially, it was an accident. I was in practice. I was treating patients, and Melissa and I were remodeling our house, and I actually I herniated a disc in my back as I was putting a new roof on this house, and so long story short, I ended up with nerve damage in my right foot. And so, 6 months later, no changes. A year later, no changes. 18 months later, I still had this nerve damage.
What were the symptoms?
So drop foot, if you're familiar. So literally, so the pain, like my back pain got better pretty quickly. My wife is a chiropractor. She was treating me, doing exercises, rehab. So the issues around the herniation and the back pain were probably 2 or 3 weeks to be fully resolved. But the drop foot, which is, I couldn't lift my foot or stand on my toes. So I was kind of like just dragging my right foot along with me. So I was wearing a bit of an ankle brace just to keep myself from tripping. But that nerve damage persisted for about 18 months. I happened to go to a show kind of like this. It wasn't the show, but a show like this where there were vendors and they had chambers. I tried a session, not because I thought it would help me, just because it looked interesting to me. I never had seen one before. This is 20 years ago. And I got in the chamber, they pressurized it, I hung out, I got out, I started walking around the hall, and I started getting pins and needles in my foot. And that was the first time I actually had felt my foot in 18 months. And I'm like, wait a minute, am I feeling that in my foot because of that pressure thing? I had literally no clue at that time, like what I was doing, what it could have done. And the guy, so I went back and he's like, oh yeah, no, that's what it does. It helps nerve regeneration. I'm like, I've been in practice. I've been helping people like nothing heals nerves like this. And he's like, no, that is what it does. I'm thinking, so says the salesman who's,
right, of course.
So anyway, but he agreed to let me try a few more sessions. So over that weekend, I did a few more sessions and I actually left with about 10% recovery of that injury. And so right away I was like, there's something more here than I ever knew. I ended up, I did buy a chamber. I treated myself for a few months and I had full recovery of that injury. And that was like, wait a minute, how did I get that far in my life and practice? That word hyperbaric was never even brought up. Meanwhile, it was the only thing that changed that nerve damage in over a year and a half. So that clearly sparked my interest.
And then once you got the hyperbaric chamber in your house, was it like a soft shell?
Yeah,
chamber?
It was a
Just
soft
like
shell,
1.3.
1.3. I didn't use any oxygen. It was an air only. Like again, I knew nothing at the time except for that one experience. And so I was using that 1.3 air only chamber for a long time before I even added any oxygen or
you don't
even
have any drop foot now that I've noticed.
Yeah, no, zero symptoms.
So
yeah, that was a full recovery. I've used the chamber a lot over the last 20 years, but not because of that. That fully resolved within a few months. I now use it for all the other things that hyperbaric can do.
The first time that I came across hyperbaric oxygen therapy, it was due to an injury. I had my first title fight coming up in Strike Force, and I was fighting my idol, Marlus Kunin, and I was like less than a month out from the fight, and I had a tear of my MCL, and I had bursitis, so I had to basically, I don't know how badly I damaged it, but I mean to the point where my leg was just like a giant sausage.
Yeah.
I mean, it was just huge, and it was hot, and it hurt, and the MCL obviously is very painful. So I remember I was like doing pool workouts, and I was just trying to drag my leg through the water because I couldn't do jujitsu, I couldn't do kickboxing, I couldn't do wrestling. So I was like hitting a heavy bag on the ground, and somebody's like, there's this hyperbaric clinic, and I have this, I said, send me to the moon. I don't care.
Like,
just help me.
Whatever it takes
just
to
try. And I still didn't understand the methodology or the method of action. But my first time, it was one of those ones where they slide you in the tube.
Yeah.
I think it's like 100% oxygen. You can't bring anything in with you. And it was like a 90-minute session, maybe 60-minute, 90-minute. I think they were trying to be pretty aggressive. But I just remember being shocked at how much the inflammation went down visibly and the range of motion that I got. And I still didn't know why it worked. I just said, can I come back tomorrow?
Yeah. Let's do this again, please.
This is good. I think this is great, actually.
Repeat as necessary.
Yes. And so I went back and, maybe over 2 handfuls of times, probably 10 or 12 times before, just like every day I would go. And then I left for the fight, and I won the fight. And so that kind of, that paid off some dividends, and I still didn't understand what hyperbarics was, but I knew that it worked in that situation. And then some years later, I ended up getting my hands on a chamber, a soft shell oxy-health chamber, 1.3, and I still would only use it kind of for injury.
As needed.
I didn't understand that there was more to it. This was probably, so my first was like 2011, and then I got a chamber maybe around 14, 15-ish, and then I used it as needed, and then I started to meet more people like yourself and the IHA, and I really started to understand there's so much science in this, and so I've always wondered, like, why isn't this more widespread?
Yeah, I mean, I think I've dedicated now the last 6 or 7 years outside of offering hyperbarics in our clinics and treating people, but really like getting out there educating, because I've seen what it does for me and my family. We've used it in our family for a number of other issues. We've now treated thousands and thousands of patients over 20 years of using hyperbaric. So in that time, 20 years ago, I did the same thing even for my patients. When I finally decided to use it in my clinic, I would use it only in cases where people, I would do this, this, and this, right? And if they got better, great. And then if they didn't get better, I'd say, oh, well, I have this pressure device. Maybe that'll help, I still, like back then, I didn't understand it that well either. And almost every time we did that, we got the result we were looking for. And I'm like, why am I waiting until the last possible tool in my toolbox before I'm offering something so safe, so simple, so easy? It's it's passive. You just have to lay down and breathe. And I'm guilty myself of using it only as needed, when nothing else worked. And so I started moving it earlier and earlier into protocols, and I started seeing that they would get better quicker, and I would need to do less of a lot of the other things that I would normally do. And as I went through that journey, I guess, as a clinician, and patients would say, well, oh, my aunt lives in Arizona. Do you know anybody? Hey, my cousin in Chicago, I think he'd really benefit. And I would start looking for people, and I'm like, this is really hard to find. I had no idea. I was just, in my own little world doing my thing. And so then I started realizing there's an amount of, I think, just general lack of understanding. And then I think there's still a lot of myths about hyperbaric that plague the industry in terms of, how if it's dangerous or not, if there's enough research to support it or not.
What are your favorite myths that you like to debunk?
I think like oxygen is dangerous, right? Like that's, and I'm not saying that it isn't, like anything, it can be. But in the traditional model of how we utilize oxygen and whether oxygen is safe or not really has to do with how long people are being exposed to oxygen. So when somebody has like COPD or breathing and heart and lung issues, we put them on oxygen 24/7. So when you put somebody on oxygen 24/7, oxygen can be very degrading to the body. And so there are some dangers around oxygen exposure. But in hyperbarics, even when we're going, and we're talking about soft chambers, which are pretty mild in terms of exposure, but even when we're going to higher pressures, like 1.5 or 2 atmospheres or even more, we're also only doing it for 60 minutes, 90 minutes. So we're not getting these incredibly high exposures over long periods of time. And so quite honestly, a lot of what most medical professionals view oxygen being dangerous, they just don't understand why they were taught it was dangerous, and that it has a lot to do with these high levels of exposure over long periods of time versus very short, periods of time. The other would be that there's not enough research. I can't tell you how many times, there's not enough research to support that. I mean, there's thousands and thousands of studies on hyperbaric. I don't expect everybody to keep up with all the literature.
Right.
I do, because literally that's my job, to keep up and to even help, add to the base of literature. But we have thousands of studies both to show the safety of hyperbaric and also to show all the different mechanisms of action, all the different things that hyperbaric can do. Now, we don't have all the studies on, MCL repair,
right?
But we have a lot on, does it reduce inflammation? Yes. Does it reduce swelling? Yeah. Does it improve soft tissue repair? Like, we know those are not even controversial to say. We see that in the literature all the time. And so while we don't have enough research for every single body part that you may have hurt, the mechanisms of healing, we have a lot of literature on that, and we just have to learn how to apply what we know to each case and make sure that we're keeping people safe and getting the job done. And so often it's most people are incredibly surprised by the impact that hyperbaric has in their life.
Yeah, I know I certainly was, and I've certainly moved it to more of a prehab than anything, and I know that more and more people are starting to do this like before surgery or before they get injured. And I think having that kind of built up in your system and having just the recovery aspect before,
right?
You're like it's like a head start.
Yeah, I mean, well, let's use both of those examples. So like in the athletic world, there's a tendency, I started to train, my performance got better. So I trained harder and my performance got better. So I trained harder and my performance got better. And often, especially in athletes at elite levels, it's like we hit a point where now we're training more, but performance is starting to tank. And because we learned earlier that more work led to more performance,
I've been there.
We see that tanking, and our first thought as an athlete is, I must not be working hard enough, right? So I work harder and it drops, and I work harder, right? So we have this
and
like
injuries.
hormetic curve, so to speak, and understanding that. So can we use hyperbaric for performance? Yes. Can we use hyperbaric once the injury finally occurs? Yes. But in my view, in the athletic world, it is a recovery tool. As my intensity grows throughout whatever season and whatever training you're doing, as my volume increases, as my intensity increases, my recovery has to increase. You can't shy away from that, or otherwise we end up on that other side of the spectrum. So hyperbaric is, in the athletic space, is, in my opinion, best used as that recovery tool that can increase and decrease your hyperbaric usage while the intensity and durations of your training increase and decrease. Of course, if you get injured, there's always a backup plan. On the surgical side, I would say if I can only treat people not every surgery is predictable, right? But when we're scheduling a surgery ahead of time, for whatever reason that we're doing this, if I could only treat somebody before their surgery or only after, I would choose before every time. The amount of impact that we can have on the recovery post-surgical by doing a series of sessions before the first incision even occurs is really incredible. And for patients that have chosen to do that, I mean, we've seen this now time and time again. For surgeons who have allowed me to show them that through their patients, I mean, they choose it themselves. It's really, you know, most people are more inflamed than they should be. If there's any damaged tissue damage, if you start a healing process, upregulating all the healing mechanisms in the body, and then go into the surgery, the body's already starting that healing journey, not already damaged, now getting further damaged through the surgery, and now we're trying to heal post, you know? Ideally, we do it before and after, but if I had to choose one, it would actually be
That's really interesting. That's a great takeaway. I never thought about it, a comparison, which is but better before or after, but that's an interesting takeaway. I get this question a lot. And as you know, I have some, you know, a decent amount of experience with hyperbarics myself, and also, you know, having some in a clinic setting that I was a part of. But people will say, well, you know, if oxygen is so important, why do I need to go under pressure? Why can't I just put an oxygen mask on, right? And, you know, both you and I know if you put a pulse ox on your finger, it's going to tell you that you're 96, 98
you're basically
capacity.
almost 100, right?
Yeah, almost 100. So it's like, well, the oxygen mask can get you to maybe 100%, which overall in the grand arc of things isn't very much. You're not moving that gradient very much, maybe 2%.
Right.
Maybe 3% if you're a little bit, you know, 4%, but not much. So when you go under pressure, if you could explain why that is so much more beneficial.
So without too much detail, we're extracting oxygen from the environment. Our red blood cells are what carry the oxygen that we bring in. And the red blood cells pick it up at the lung level, carry it through the body, and then deliver it at the cellular level.
Primary job.
Right. So we're limited right now, you and I are limited to how much oxygen we could deliver to any cell based on the quantity and the health of our red blood cells. The red blood cells are swimming in liquid plasma of the blood, but that plasma carries a little bit of oxygen, but very little. And so under hyperbaric conditions, can we saturate red blood cells? Yes. And so are we, you know, we're 98% saturated. Can we get that extra 2%? Yes, that's easy. But really, because we're creating such an increase in pressure, we're now driving, we're saturating red blood cells, but now we're actually bypassing red blood cell carrying capacity, and we're starting to dissolve oxygen into that liquid portion of the blood. So the liquid portion, the plasma, is almost an unlimited reservoir of like extra oxygen, if you will, that's possible to be carried throughout your circulation inside that hyperbaric environment. So instead of only getting 1 to 3% on red blood cells, you know, even in a, let's just say as a good example, in a soft chamber, air only, you're going to be almost 30%. So right away, all you've done, you're not even breathing oxygen, increased oxygen, you're breathing air, but that pressure gradient will drive almost 30% more. If you start adding oxygen or even higher pressures, you can go anywhere from 30% to 3 times, 5 times, 10 times. If you're at 2 atmospheres on 100% oxygen, you're at like 14x the amount of oxygen. So there is literally no other way to generate a reservoir or a surplus of oxygen that's that extensive other than changing atmospheric pressure, which would be impossible, or going into a chamber which is mimicking, you know, increased atmospheric pressure, you know, temporarily.
Yeah, Dr. Joe DeTuri, I know you're familiar with him. I had him on my podcast. It's been a while now, but 100 days under the ocean, and what he saw, I'm curious your thoughts on that. I mean, even lengthening telomeres.
Telomeres, reducing inflammation. So, you know, that was fun because, you know, very few people have spent anywhere near that amount of time, you know, let alone close.
Do you remember what his atmospheric pressure was there?
Yeah, so it's about 1.75.
Okay.
So, you know, deeper than a soft chamber. So, but
and when we say soft chamber, by the way, we're literally talking about the material. The chamber is actually soft and flexible. So when you get out of the chamber, it would be like a loose kind of like tent, if you will, for people who have never been in one. And then there's the steel chambers, which are obviously made out of steel. They hold more pressure and they don't change.
So essentially, and that's a good distinction. Like, you can use mild pressures, like you could use soft chamber pressures in a hard chamber.
Yes.
So the distinction really shouldn't be what the material is. That's a good point.
Yeah.
The reason we often defer to that is just because soft chambers have a pressure range that they cannot exceed.
Correct.
So that, for atmosphere purposes, that'd be, right now we're at 1 atmosphere, it's 1.3 atmospheres in a soft chamber. So you can treat at 1.3 in a hard chamber, but you can't exceed 1.3 technically in a soft chamber. And so, so he was at 1.75 on air, so there was no additional oxygen, that was just straight air at 1.75, which is about 70% more oxygen than what we're getting right now, right?
Okay.
So, so significant, but nowhere near like 2 atmospheres on 100%, which is 1,400. So, but yeah, we saw, I mean, measurably, anyone who's ever spent that amount of time underwater is usually doing ocean research, which he was also, but no one's ever actually studied the person. So we had the opportunity to do a lot of testing on him, so that while he was there doing everything else he was doing, we just got to watch the effects of what happens to the human. So we saw inflammatory changes, we saw epigenetic changes, we saw telomere changes, we saw cognitive changes. So, essentially, not that anyone is probably going to typically spend 100 days in a row underwater, but we see similar changes even just from the repetitiveness of, a few days a week of using the chamber over longer periods of time. But yeah, I mean, that was really cool to get to watch him.
One of your favorite explanations that I've ever seen on your platform, which, by the way, tell people like your platforms that you educate on. It's like on Instagram. What's your handle? Which one?
I don't know. I think it's HBOT USA is our company.
Yeah.
It's like our YouTube channel, which is where all the longer conversations occur, where there's just more detail, is all on YouTube, and then we cut that up into smaller shorts.
I saw one on Instagram once, and you were talking about the benefit of actually the decompression, if I could regurgitate that well. So it's like not just going and being under the pressure, and not just about living under the pressure, but how beneficial it is to leave the pressure.
Right.
Because then could you explain that, like the capillaries kind of like push more oxygen out to maybe places that they wouldn't necessarily reach?
Yeah, as we were saying earlier, the red blood cells are carrying it. In hyperbaric environment, we're saturating that, but now we're supersaturating the plasma. The ability to supersaturate the plasma is only possible because of that pressure. So while you're in the chamber at whatever pressure you're going to, and however long you stay and whatever percentage of oxygen you're breathing, that'll dictate the total, let's say, loading of how much extra oxygen your body's going to hold. But that can only stay there for the time you're in the chamber. Once you get out of the chamber, that pressure is no longer holding the oxygen in circulation. It's almost like opening a bottle of seltzer and the bubbles start coming up.
Yes.
When you get out of the chamber, the gases that were dissolved, the oxygen gases that were dissolved in your blood can't stay there anymore. You're taking the cap off.
Right.
And then
So
when you
they
take the
begin
cap
to
off, the oxygen now is trying to come out, but it can't actually ever leave your body. So as it comes out, it's leaving your circulation, but it's actually being metabolized by surrounding cells. Especially when there's damage and trauma, there's inflammation, which are all barriers of oxygen diffusion. So now you've dissolved all this oxygen, let's say for your example, like in your knee, or my example around my back, all this extra oxygen is in circulation, but those capillaries are damaged. That's why you have swelling, that's why there's bruising. And so you can't really nourish those cells as well, because the blood flow, the highways to carry oxygen are damaged. But when you get out of the chamber, now it's trying to get out. The distance that oxygen can actually migrate before it gets metabolized is much greater, up to 4 times further. And so all of a sudden, this like hypoxic, or even in real severe cases, necrotic tissue, all of a sudden is getting access to oxygen that literally would have been impossible any other way.
One of my favorite testimonials that I personally witnessed when I was a part of a wellness center was one of our very first clients was a woman who had, she went in for a mommy makeover. So she had a breast lift and she had a tummy tuck, and surgery went really long. Turns out the surgeon was not able to reestablish blood flow to the nipple. So of course it began to be necrotic.
Becomes necrotic,
Yeah. And I mean, it was as black as the night. I mean, it looked dead. Like I didn't think that there was any way that you could revive a tissue that looked like that. But her surgeon, long story short, was like, I heard about this place in Vegas that has this thing, hyperbaric oxygen therapy. I don't know if it works, but why don't you give it a try? Because I mean, her husband was losing his mind. He was like, I don't care what you have to do, but my wife should not have to live the rest of her life without her nipple. He's like, do I need to give her mine? Like, what do we need to fly on leeches? Like, what? I mean, this husband
we
was
don't
like,
need
really,
them, so.
yeah. He's like, take mine, just don't save my wife's. I'm sure it was purely good intention, on his part, of course. Nothing selfish about it.
Right.
But she found her way to us, and we treated her very aggressively. I think at 2.2, which is like the highest we were treating at that time, twice a day. And we did use red light as well, but other than that, nothing else changed. And after her first session, which I'm sure you've probably witnessed this before, there was noticeable pink back in her nipple. And a lot of it had already lightened. It wasn't so black anymore. It was more of like a deep gray. And the way that I explain that to people is when you talked about the highways being broken and basically the blood isn't getting in there and out, but the fluid in your body, when it becomes oxygen rich and saturated, can seep.
Right,
basically.
goes to places where otherwise would have been impossible.
Where, blood vessels may not, or blood cells themselves may not be able to go and come back and do their primary job, which is deliver the oxygen, because the tissue's too damaged. So basically everything had been cut around the nipple, and the angiogenesis, the growth of those new blood vessels, hadn't really happened, and it just wasn't happening, and the tissue was dying. Needless to say, after a few weeks of treating her extensively, we saved the nipple.
Yeah.
Save the nipple.
Save the nipple.
Do you have any testimonials?
Yeah, I mean, so first of all, there's two pieces of that. One is the short term, which is the short term, even with broken highways, we can oxygenate, right? So almost right away in a lot of those cases, 2, 3, 4 sessions, you start to see dramatic changes. But most important is that angiogenesis. So what happens after, let's say, 4 or 5 sessions is just hyperoxygenating something that's dying. What happens after 10, 15, 20 hours is it stimulates new blood vessel growth. And once you establish new blood vessel growth, now you've rebuilt those highways. So when you pull the therapy away, the body can just continue to oxygenate on its own. And so it's really like a 2-step process there. It's like that initial save it, and then the sort of follow-up of the rebuilding that needs to happen so that you're not dependent on hyperbaric to keep your nipple, or whatever the injury is. It's like now it can just heal and be healthy in the long term, even without additional sessions at some point. I mean, in our clinic, I mean, we've literally, at this point, we've treated, I have no idea how many thousands of people, We started just recently, actually, in one of our meetings in the office, like we started talking about just sharing more of the stories, even just with one another. And this might sound crazy, but you almost start to expect the unexpected. Like you almost become, and I never thought that would be possible. Like the amount and the type and the cases that come through and the changes that people see, for your first handful of years, you're just like, I can't believe I have like one of the best kept secrets ever. Like, how could so many different people benefit from this therapy? And then you become numb. You're almost like, God, if somebody doesn't respond, you're like, oh my God, that's crazy, because we see these changes and these miracles all the time. And we have to be careful not to say, like, we use hyperbaric off-label predominantly, and so we're not treating diseases. So we do have people that come in with a range of different autoimmune diseases. We have people who come in with a range of different neurodegenerative diseases. We have people who come in pre and post surgery. There's a lot of reasons that hyperbaric could help based on those mechanisms of action we were talking about. But to see somebody, let's say post-stroke, who starts to recover, but they're plateauing, and all they really want is basic quality of life abilities, like to go to the bathroom without any assistance, or maybe to get their license back, depending on their story, or at least just to not have so much spasticity, or or even feed themselves, right? And so you start to see people heal, regain their independence, regain quality of life. Kids, with pretty complex neurological issues, improve their language, or their ability to listen, improve their socialization, or get over some of these developmental delays that maybe they were from either birth trauma or just other toxicities or issues in their life. But I mean, literally, like every day there's dozens of people, and their stories are incredible because so this, like, I've tried everything, I don't know what else to do, and then they try something simple like this, and it's literally life-altering in an incredible way in pretty short order.
Well, oxygen is currency in the body. If you just think about it that way, when I explain that to people, sometimes like a little light bulb goes off in their heads. Like, you eat and you drink and you do these other things that you think are important and serve to give you energy in your body. And I'm not saying that they're not important, or supplements or all those things are great, but our primary source of energy is oxygen. How long can you go without it? I mean, that answers the question right there. So it's so important. And when you can hyperoxygenate, you basically make the doctor that's already the best doctor in the world, which is your own body, knows exactly what it wants to do. It just needs the resources to be able to do it.
Exactly. Think about it right now. A healthy person is fully saturated, right? If we took any healthy person off the street, they're going to be 98, 99% saturated. You have to be fully saturated with oxygen just to sit here and have this conversation with me. So how much extra oxygen is available at any time to now heal from this surprised injury that I didn't understand was happening, or this disease process that's now starting in my body? Like, our resources are capped under normal atmospheric pressures, and they're capped in a way that really we need to replenish our oxygen every minute of every day just to talk to each other and hang out and have a normal day. That surplus becomes an incredible bank account. If we're using currency, it becomes like a bank account that now the body can pull from.
It's like winning the lotto.
Yeah, literally. And it's like, in so many cases, I think that's why we see such dramatic change. Is like, for my back injury, I did everything. Like, my background was exercise physiology before that. So I was doing my rehab, I'm doing my exercise, I'm getting adjusted, I'm getting massage, I'm getting acupuncture, extensive background in nutrition, I'm doing all the anti-inflammatory stuff, everything that I knew to do, which made no obvious impact on that nerve damage that I had. And in 1/2 hour of a chamber, I got feeling back in my foot, right? Now, was it that dramatic because I had done all those other things? Maybe. That's also possible.
Maybe moved your baseline starting point to where that could become the focus.
But it still just needed, there was nothing that, there's no substitute for oxygen. We can't take this other thing. Right. Like, we can't take it in a pill and be like, oh, I got my oxygen. Like, that is such an important currency. I like that term to use for it. And when we have a little bit extra, the body knows exactly what it's not foreign. It's not a medication. It's like, oh, I just got more of this thing that I needed to heal this area. And
I think about it like building a metaphorical house. The more oxygen that you have, let's say that you have injuries, and I paint this picture for people a little bit. That would be like having holes in the roof of your house, or that the framework isn't super stable, right? And what the currency you have is how much money you can go to the store and buy supplies to fix that. Right. So it's like, are you only able to afford paper mache? Well, okay, maybe on a sunny day that might help a little bit, but come the rain, that's not going to hold up very good. So I think when I think about that, it's like when you win the lotto, when you have all the oxygen, when you have all that, then it's like you don't even have to fix the house. You could build a brand new one.
Right.
I mean, it's like just the mansion you've always wanted. Exactly. And that's kind of how I look at it. One of my favorite things. One of my favorite things about working in the wellness center and seeing too, I'll talk about one more testimonial, and then I want to get into one study that I really liked, and I also want to get into debunking a little bit or talking a little bit about some of the science. Not too sciencey, but we'll talk about your favorite studies. There was a mother who came in who had a child who was on the spectrum, diagnosed with autism, nonverbal, and after maybe 5 or 7 sessions, right around in there, I witnessed it myself. That child came out of the chamber and said, "Mom." And I mean, we all bawled. We all cried, because it's just like such an incredible thing to witness. The first word of this child, who is about 6, and you just like, wow. And I know you've experienced it, I'm sure, many, many times.
Yeah. I mean, the science behind it, let's just say, we know it's well documented that most of the kids that are diagnosed on the spectrum, they have lower, 70% of these kids have hypoperfusion to the prefrontal cortex and the temporal lobes of their brain. Prefrontal cortex is like executive function, sort of behavior.
But is that low blood flow?
Low blood flow, low oxygen to those areas, right? So those areas underdevelop, and they're in charge of executive function, behavior, ability to like control, like impulse
And the
control.
brain in general uses a ton of our
Right,
daily
like
oxygen.
20%
It's very
of
expensive.
our, right. So it's like 2% of our body mass. It uses like 20% of all of our oxygen. And the temporal lobes are language, right? So you have these undernourished areas of the brain that go underdeveloped. And so all of a sudden you're driving oxygen into these areas, and it's like they're just learning very slowly. There's a blockage in their ability to like get that to click. I mean, I can't even tell you how many kids had their first word in our office. And that's like what I'm talking about. It's almost like, you're like, you expect it to happen, which is crazy, because if you go anywhere else and you tell people that, you're like, no, there's no way. But
when you see it
like
enough.
you see it enough, and I mean, whether it's their first word or they had, singular words here or there, now they're getting like grouping words or sentences, or, their receptive language as well as their receptive language. I mean, we see this kind of thing all the time. And again, to be careful not to say like this isn't the cure for or the treatment for autism. There are very specific hallmarks of each of these conditions. Let's say autism being one. There's brain inflammation and there's hypoperfusion. We know that. That's not controversial to say. Hyperbaric hyperperfuses something that is not perfusing well, and it reduces inflammation. So like, here's the issue that the person's experiencing. Here are the mechanisms by which this tool works. Does it make sense to apply this tool for these issues? If the answer is yes, we do it. If the answer is no, then we don't. But in so many of these cases, the answer is yes, and the results are incredible. It's amazing.
It is amazing. Okay, one of my favorite studies, interesting studies, it was kind of a mean study if I think about it, but I think it was 1959, if I remember correctly, where this doctor sanguinated some pigs, like drained all the blood out of the pigs.
Yeah,
life without blood. Yeah, thank you. And then he put in basically plasma, but put them under 3 atmospheres?
3 atmospheres on 100% oxygen.
On 100% oxygen. And the pigs live for about 45 minutes, and I think they only maybe passed because they took them out.
They didn't even, though, so
they didn't even,
I believe, like I have a video on this one day, I'll show you.
Okay.
It sounds like you'd enjoy it. But essentially, they were reinfused with their blood, and they were brought back up, and then they were fine. I think they were killed for the purposes of studying like what happened, like neurologically, like to dissect the brain and everything to see if there were any other changes. But yeah, I mean, what that was saying was, hey, we have red blood cells, but hey, I think red blood cells, while they're necessary, obviously, they're an adaptation to planet Earth. In other words, if I go to Denver, if I lived in Miami, which I do, and I go to Denver for a month, I will increase my red blood cell count because there's less pressure in Denver than there is in Miami. In order for me to get all the oxygen I need more taxi cabs because the cabs are not full, right? So there's a natural adaptation to going to less pressure, where if somehow there was more pressure and we lived there like Joe for a long period of time, red blood cell count would actually go down, which we saw.
It did.
So because the body didn't need as many, it's not going to hold on to this, right? So then the question was, well, if we had enough pressure, could we remove all the red blood cells and actually like be alive, right? So that's what Life Without Blood was really about. And that study, although I'm sure they would never be able to replicate it at this point, but that study showed that red blood cells are obviously critical for life on Earth. However, they're an adaptation to pressure. And if it's not the red blood cell delivery that's so important, that's another myth inside of hyperbarics or in oxygenation in general, that even though we created this surplus of oxygen, it's not useful because only oxygen that's bound to red blood cells is useful. Well, that's not true. And that study was actually one of our first understandings to show that like red blood cells are important under these current conditions, but in different conditions, we wouldn't need them. That free-floating oxygen is just as effective as red blood cell bound oxygen if we had enough pressure, But yeah, that was like an early one that really set the stage to understand, I think, the impact, of increasing free-floating oxygen. I think more recently there's been a lot more studies looking at, I guess more in like a regenerative medicine type of version of, can we improve cognitive function in older adults, right? Like there's an assumption that like as we age, we deteriorate. And while on some level that has to be true, I still believe that we deteriorate much faster than we were designed, and we suffer for longer than we need to. And so the questions start to become like, are we able to maintain a much higher quality of life for a much longer period of time than what we currently see in people? We're already pushing the boundaries of longevity in many cases, average life expectancy, late 70s, early 80s. People living to over 100 are one of the largest percentage-wise growing populations in America. So we're seeing longevity being pushed, but we're not seeing quality of life keeping up. And so we see, in a lot of cases, we see this decline in our health, even though longevity is being pushed. And most people don't want that. Most people would say, I don't even want to live a long time if I lose. I don't want to be sick for 15 or 20 years. Like I want to be healthy as long as I can be, and then one day not wake up, right? So we have a lot of, we have a long gap to fill in terms of like, how do we improve that gap between when our health starts to decline and when we actually are no longer here, you know? So a lot of these studies that are coming out now are looking at, well, what role, and not hyperbaric in a vacuum by itself. There are so many components to add to hyperbaric that synergize with hyperbaric. But even if we did look at hyperbaric alone, what role does hyperbaric play in healing, recovery, regeneration, stem cell mobilization? There are certain hallmarks of aging, and quite honestly, hyperbaric almost addresses every single one of them, even by itself. When we start adding some of these other therapies, you mentioned red light earlier, like all of a sudden we stack these components to really nudge certain ones further along maybe. And so, but we know that oxygen's a requirement for life, and obviously when we get a little bit more, it doesn't have to be a lot more. It's typically just a little bit more over a long period of time. All of a sudden we can start shifting that health picture for people and moving them into this much higher quality of life for much longer. And so the studies that are really looking at that are some of the ones that are, have excited me the most. They were the ones, I did some research a couple of years ago that I'm still working, I published some and I'm publishing some more papers this next year. But that really sparked my interest in what we were studying. So we took healthy people with no diagnosis whatsoever. We measured inflammation, we measured cognitive performance, we measured epigenetic changes, we measured telomeres. Because I wanted to say, listen, I think most people have more inflammation than we should. I think most people's brains are probably not operating at the highest level possible. I think that most people are, even if they're symptom-free and diagnosis-free, they're still moving in an unhealthy direction. Can we take that healthy population and still see these positive changes? And essentially we did, almost across the board. So.
That's amazing.
Yeah.
I was going to ask you some of your favorite studies and what you lean on and what you like, but you're conducting your own, and it sounds like you kind of answered my question already. Okay, I know we're closing up. You got to get out of here. You got speaking engagements to do, but what did you think about the study that came out of Tel Aviv about the lengthening of the telomeres? I know we talked about that with Dr. Joe as well, but I mean, that is insane. It was just never been done before. I mean, that's been like one of the hallmarks of aging, right? And people have always like wondered, how could we do that? And then the science community kind of proves that. And then I guess my closing question is, why do you think hyperbarics isn't more understood, more utilized, more, out in the forefront?
So the telomere study I think was a landmark study in terms of, because it looked at telomeres and senescent cells, which are like, let's say unhealthy, old unhealthy cells that aren't, a healthy contributor to their environment. Mm-hmm. And so reducing senescence over time is important for healthy aging, and obviously telomeres they're really not causal, but they're correlated to improved longevity. And generally, most of the things that we're looking at from a telomere standpoint are, can we slow the shortening, right? Virtually nothing actually reverses that. Mm-hmm. So seeing that the therapy actually increases the telomere length was an incredible journey of understanding the physiology of how, the DNA are protecting itself, and reducing cellular senescence.
The telomeres are like the end caps of your DNA.
Yeah, they're just like, people say it's like the cap on your shoelace, like it stops it from fraying, mm-hmm. right? And when you lose that plastic tip on your shoelace, the shoelace starts to fray, starts to break down. So having really strong caps is a sign that your DNA is well protected, essentially. Mm-hmm. And so, shortening is associated with, let's say, more inflammation and less overall health and older cells. Lengthening of telomeres is generally a sign of youthfulness and improved health, let's just say. But again, it's not causal. So that study I thought was a great eye-opening, like, wow, this is definitely changing the quality of life longevity conversation. That really sparked a lot of what I chose to do in the research that we did in terms of looking at epigenetics, because epigenetics would be like one more layer deeper of understanding what's influencing, let's say, DNA damage or DNA repair, what's influencing telomere shortening or telomere lengthening, or even what's influencing the inflammatory changes that we're seeing or the tissue repair and regeneration. Like if we understood what triggers, what switches were being turned on and off, then we start to really understand, like at the deepest level from a physiological standpoint, biological standpoint, like what's hyperbaric really doing. And so I think that's the direction, that's the future direction. I think a lot of the hyperbaric research, especially in the longevity space, will be expanding and exploring the role of hyperbarics on epigenetics, because that's really like, I think, the baseline understanding of current health and what you want to do for, let's say, for future health. In terms of why it's not being more utilized, I mean, I hate to even say it this way, but and maybe I've been doing it too long and I'm not sure, but a little jaded. There's not a lot of money in it. Like you can't patent it. You know, Merck isn't like, hey, I want to pick up on this HBOT thing and like patent a new oxygen molecule. Like there's just not a whole lot of vested interest on large organizations that have large sum of monies that want to help fund research. I mean, funding research is incredibly expensive, time consuming, and you know, there's literally, I can count the number of people contributing to this probably maybe only on one hand, but let's just say on two hands. Like there's very few of us that are really that interested and that dedicated to trying to move this forward. That's expanding, and I'm hoping that with that expansion comes a much greater level of uptake. But like a lot of things, medicine is slow to evolve, and medicine evolves slowly based on research, which is even slower to evolve. And when you see an industry really growing the way hyperbaric is growing, it's not because the research is driving it, it's not because the doctors are driving it, it's because patient demand drives it. And now we're finally seeing patient demand is like higher than ever. People are understanding it better, they're looking for it more, and they're the ones that are really, I think, helping to encourage, let's say, practices to open and expand their offerings and deliver tools like this so that they actually have access to these incredible therapies. So, you know, the future is incredibly bright. I mean, I've been saying that for 20 years. Every year it gets a little brighter, quite honestly, and I think I'm excited to be a part of it in this stage, and having, you know, people like you so also excited and passionate about it, which really, like, it just brings it, you know, even closer to, I think, the potential that it has as a tool for everybody.
I hope so.
Yeah.
Is there a website or anything? You do newsletters, anything that people should know about?
Yeah, I mean, I put out, so I have like 650 videos on YouTube. Most of them are like 5 or 10 minutes. Like I try to do hyperbaric in small bits so people can like take in a chunk and move on with their day. So we put that out every Tuesday. There's shorts that are made from that go on other places like Instagram and things like that. HBOTusa.com is our main website. We don't sell anything there. It's strictly like informational, like what does it do, how does it work, and is it something I should consider for me? It's really what that site is dedicated to. Most of what I'm really doing for a living is teaching it, you know, training practices, training clinicians and technicians, helping people build businesses, and doing a lot of consulting work on the business side, just to try to get this thing going, because I know how powerful it is. I know how many people need it. And I guess we've really keyed into how to make this thing successful and how to shortcut that process. And so we're spending a lot of time there. Those courses and those offerings live on another website called thehbotcourse.com.
Great. Well, thank you so much for sharing your knowledge today. I cannot wait to see, you know, your talks later.
My talk later will be on the research.
Perfect. That's what I love. I've sat in on a few of yours, so I've learned a lot. But thank you. This was great, and I think the audience is really going to appreciate it, and hopefully get some more people getting those life-changing experiences with, you know, as you and I have witnessed. It's out there, so go get it.
Exactly. Thank you.